Good morning to one and all. Happy to meet you again with a new topic of congenital heart disease, that is transposition of great arteries. So I am Saranya, assistant professor from Triplum College of Nursing. So the objectives of this session is we are going to define the transposition of great arteries, then to the incidence, causes, pathophysiology, clinical features, diagnostic evaluation, management, complications, and nursing diagnosis. Let's see the disease condition. So, for an introduction of TGA, that is transposition of great arteries, it is known as dextrotransposition of great arteries. Why it is called as dextrosis? You all know there are two main arteries carrying the blood out of the heart. The one is main pulmonary artery and the other one is the aorta. These two are switched in position. They are transposed. They are transposed from each other. Because of this, the baby have a defect, and the baby having such a defect should undergo a surgery or a procedure soon after the birth. So, for the proper known definition, transposition of great arteries is a cyanotic defect in which the aorta rises from the right ventricle and the pulmonary artery arises from the left ventricle, resulting in two separate and parallel circulations. So, when you go back to the physiology of the heart, you can very well confirm this transposition. So, here the aorta arises from the right ventricle and the pulmonary artery arises from the left ventricle. So this transposition has been occurred when the baby is born itself. So this is called as transposition of great artery. So in this picture, you can visualize the normal anatomy of an heart where the aorta is present and the pulmonary artery. And in the TGA, that is the transposition of great arteries picture, you can see the position of the aorta and you can see the dilated pulmonary artery. So the entire anatomy of the heart is changed or transposed. Yes, and in the normal blood flow, the aorta carries the oxygenated blood, but from here, since it arises from the right ventricle, the aorta carries the deoxygenated blood. Next, coming to the incidence, transposition of great arteries accounts of 9% of congenital heart defects. It occurs more than in male babies than in females, and it is usually seen in term infants. So what will be the causes is you can the history of German measles, that is rubella, or any viral illness in the mother during pregnancy, and drinking alcohol or taking certain medications during pregnancy, smoking during pregnancy, and poorly controlled diabetes in the mother during pregnancy. These are the causes which constitute transposition of great arteries in a baby. So, on seeing this picture, you can see this normal circulation of a heart. So, the circulation starts from the inferior and superior vena cava, coming to the right auricle, from the right auricle to the right ventricle, then it rises to the pulmonary artery, then it goes on. But here you can see the right ventricle is being leaved by aorta, which is carrying an deoxygenated blood, whereas the left ventricle is being leaved by pulmonary artery. So it is being interchanged or transposed. Let's see the pathophysiology. So coming to the pathophysiology, with great arteries transposed, the pulmonary artery arising from the left ventricle carries blood to the lungs for oxygenation. So this oxygenated blood returns to the left atrium and then to the left ventricle. So from left ventricle through the pulmonary artery, the blood is recycled to the pulmonary circulation. So the aorta arising from the right side of the heart delivers the unoxygenated blood to the systemic circulation. So I repeat, the aorta arising from the right side of the heart delivers the unoxygenated blood to the entire systemic circulation. So this blood then returns to the right atrium and ventricle and without being oxygenated is being circulated back to the systemic circulation via aorta with progressive hypoxemia. So mixing of oxygenated and the unoxygenated blood occurs in presence of associated lesions, that is patent foramen ovale, which ASD, VSD, that is patent ductus arteriosus, or collateral circulation. So if none of these lesions arising from left ventricle carries blood to the lungs. So this is the circulation of a neonate with the, this picture shows the circulation of a neonate with the TGA. Coming to the clinical feature. So the entire pathophysiology has been changed. So now the child is diagnosed as TGA. The features includes cyanosis is always present because there is highly mixing of the oxygenated and the deoxygenated blood. It may be mild if mixing occurs through a large VST or PDA. It may be severe if ventricular septum is intact or PDA is closing. Hypoxic spells, especially during crying or exertion of a baby. Clubbing secondary to cyanosis may be seen in older children. Coming to the diagnostic evaluation, cardiac examination, murmurs. If murmurs is present are usually those of associated cardiac defects such as PDA or VSD. So the first sound will be the murmurs associated to PDA or VSD, either rash systolic murmur or pansystolic murmur. The second heart sound is single and it is increased in intensity because of aorta arising from the right ventricle. And coming to the ECG may be normal for a neonate or it can demonstrate either right ventricular hypertrophy or sometimes left ventricular hypertrophy or combined ventricular hypertrophy is uncommon. Either right or left ventricular hypertrophy it disposes. Coming to a chest X-ray. Heart size may be normal or moderately enlarged. The cardiac cellulite may assume the shape of an egg lying on a string, and the pulmonary vascularity may be normal, increased, or decreased depending upon the extent of the defect. So this reveals the chest X-ray. Now coming to the echo. The color flow of 2D echo diagram is extremely useful in establishing the diagnosis and evaluating the presence of associated cardiac defects, either presence of VST or ASD or PDA, etc. Coming to the medical management, the first medical management is prostaglandin infusion is given intravenously to keep the ductus arteriosus open until a palliative procedure or a definition of definite surgery is being performed on the baby. First one is the prostaglandin infusion. Next, coming to the oxygenation therapy is profoundly used in the neonates because the baby will be in cyanosis as it enhances the enclosure of closure of PDA, which may be the only source of mixing of blood in TGA. Coming to the surgical management, so all the surgical management, moreover, they will try to make within the a few weeks of life of the neonate. So the first one is palliative surgery, that is Rashkin procedure. So enlargement of interarterial communication by arterial balloon septostomy is done during cardiac catheterization. It enables in establishing the adequate mixing of oxygenated and unoxygenated blood of these infants. So in this procedure, what is done is a balloon catheter is passed through the foramen ovale that has been inflated and then pulled back to tear and stretch open the foramen ovale, thereby creating an enlarged opening between the two aorta. Yes, you can visualize in this picture that is a balloon is inflated and you can see that this is known. The next procedure is Belloc-Hellon procedure. So creation of an ASD or enlargement of foramen ovale surgically is termed as Belloc-Hellon procedure. So following these palliative procedures, the infant will continue to be cyanotically, especially while crying, feeding or exposure to cold temperature. Next, coming to the corrective surgery, that is arterial switch operation procedure. This is the most preferred surgical procedure for repair of TGA. So what happens in this procedure is the pulmonary artery and aorta are transected above the respective valves and switched back to the appropriate ventricles. So what is wrong? It is being directly resected and corrected. So when you in our hospital, you can witness the babies undergoing this kind of surgeries. Yes, and the baby is reverting very nicely. So in this picture, you can see the transposition of great arteries. So the left and the right coronary arteries removed from the aorta, and you can see the step 1, the pulmonary artery move in front of the aorta. Then in step 2, the pulmonary artery is reconstructed. Yes, so this is the arterial switch operation. Coming to the Senning's procedure. This procedure creates the same direction of blood flow but without the use of pericardial patch. The arterial septum and a portion of arterial valve are used to reroute the blood flow. The above three procedures are recommended in first year of life. So you can see the baffle in this picture. So coming to the nursing management. So the surgical procedures and the medical management is over. So what is a part of nursing management is you have to obtain a thorough history of the infant from parents and perform a head-to-toe physical assessment properly. Vital signs and oxygen saturation to be monitored. Very, very important. The skin color changes, that is pink or cyanosed, to be noted. Extremities are checked for peripheral faults, edema, color and temperature, and presence of clubbing of the patient. Heart sounds to determine the rate, rhythm and identify any murmur. Signs of the respiratory distress. Child's level of activity, tolerance, child's growth and development in their level of growing. So these are the nursing managements to be implicated on a patient. Next, coming to the complications. So lack of oxygen to the tissues. Sometimes heart failure. Heart failure is a condition in which heart cannot pump enough blood to meet the body needs. These two are the major complications. Next, coming to the nursing diagnosis. So, decreased cardiac output, activity intolerance, compromised family coping, risk for injury, and risk for infections also. So, as a sum concluding this session, the transposition of great arteries is a serious and rare heart problem in which this main two arteries are transport, but This condition is present at birth as a congenital heart defect, which can be reverted with undergoing the surgical procedures. So the references. So thank you for listening and acquiring knowledge about transposition of great arteries.